Hi, it's Dr. Amanda from StraightSmile Solutions. I'm here today in our restroom to show you some tricks and tips about virtual check-ins and virtual consults, as well as some tricks and tips about cleaning clear aligners. Let's go ahead and begin. Virtual consults and virtual check-ins are really important, especially in the age of COVID and post-COVID, because patients don't always want to have to come into your office unless they really need to. So they're getting more excited about using virtual ways to communicate. And dentistry is following right along. There are lots of predetermined apps that already are made for this. Some of them would be like GP ortho tracking, dental monitoring, but there's also just a ton of HIPAA compliant platforms. Or you can use HIPAA compliant email in which you can communicate. And I think this is going to be a great way to save your chair time and to get more starts. Patients will really love the convenience as well, and you can advertise it on your website. So let's go ahead and begin and show you a little bit more about what we're looking for. So you can use an actual live video chat like Zoom for healthcare if you want to, where you're sitting facing the patient, but sometimes a little inconvenient for scheduling. So I like the idea of just sending static images at the patient's convenience. I think it's just way more convenient for both of you. And you can tell a lot just by static images. Now, right now I'm going to be talking and narrating, so it's going to be a little difficult, but I want to give you an idea of what we're looking for, what type of images we need. I like to make sure your patient gets a set of retractors, but if they can't get retractors from Amazon, you can send them a set and buy them in bulk. They're only a couple dollars each, or even less if you buy them in big time bulk. But they can order it themselves, or they can use spoons or chopsticks to go ahead and show their back teeth. You want to make sure that putting the retractors in and they're showing right, left, top, bottom, and front, as well as all angles of their face in a relaxed position. You want to see their lips closed. You want to see their profile. And you want to go ahead and also make sure that you're seeing all the way back to the molars on the back teeth. I'm going to go ahead and put the retractors in, and you can kind of see what we're looking for. If you're using static images, you want to make sure they're zooming in though. So for the sake of simplicity, you're not going to see the zooming right now, but I'll go ahead and attach at the end of this video a little bit more examples of what we want to look for in terms of the static images. Now, of course, your patient may not be a professional like YouTuber or Instagram star, so they may not be so great at their images, so it's just a light screening tool. This is not meant to be at all a replacement for the actual clinical exam. It's just a way to screen out patients who clearly have dental issues or concerns that can't be treated by clear aligners. Let me show you real quick. So now you've seen my teeth. I've already had ortho. But in any case, you get some idea of what we're looking for, what we can see, and it just gives you a light idea if they're a candidate and if they're maybe ready to come in for an in-person screening or clinical exam. In addition, let's go ahead and talk about virtual check-ins. Basically the same idea as a virtual consult, except for they're going to have their aligners in. So you want to make sure that you're getting a set of photos with the aligners in and with the aligners out. That's the really important part. So that's a total of 10 photos, right? Right, left, top, bottom, front with the retractors. Right, left, top, bottom, front with the aligners as well. So in and out, that's 10 photos. All right, thanks so much. If you want any more tips and tricks on virtual consults and virtual check-ins, don't hesitate to reach out to us at StraightSmileSolutions.com. All right, thanks so much. Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and you may have watched the first part of this video where we're actually demonstrating the virtual consult. This is actually a handout that you could theoretically, if you want to copy it, you want to have a copy of it, just take my branding off, use your branding. Personally, I really don't care. You can use these photos because I have the rights to them, and it's a family member. So go ahead. I give you permission to use these photos. So if you want to use them for your demo, because they're really good photos, high quality. But this is the type of handout that you'll want to send home with your patient when they are doing virtual consults or virtual check-ins. And, you can always replace the virtual consult with virtual check-in. If you're doing virtual check-in, of course, you're going to want to have a set of photos with the aligners in or the appliances in and a set of photos with the appliances out as well. And of course, for check-ins, you don't need the extra oral photos. But give me a holler if you want a copy of this. You can go to StraightSmileSolutions.com, send us a message, or you can just email us at info@StraightSmileSolutions.com. We'll be more than glad to send you a copy of this. All right, thanks so much.